ওয়েলকাম টু ফার্মা বেঙ্গলি। আমরা এই ভিডিওটিতে ইএসআইসি 2016 ফার্মাকোলজির কোশ্চেনগুলো কি কি এসেছিল সেইগুলো দেখে নেব এবং সেইগুলোর অ্যান্সারগুলো জেনে নেব। তো প্রথম কোশ্চেনটি হচ্ছে, হুইচ অফ দ্য ফলোয়িং অ্যাভয়েড ফার্স্ট পাস এফেক্ট অফ দ্য ড্রাগস? অপশন এ ওরাল ইনজেকশন, অপশন বি রেকটাল সাপোজিটরি, অপশন সি ইন্ট্রাভেনাস ইনজেকশন, অপশন ডি নন অফ দ্য আদার অপশনস। The correct answer is option C, intravenous injection. Next, in which of the following phase of clinical trial of drug ethical clearance is not required? Option A phase 1, option B phase 2, option C phase 3, option D phase 4. The correct answer is option D, phase 4. Km value indicates option A impurity of enzyme, option B physiological role, option C purity of enzyme, option D affinity. The correct answer is option D, affinity. Which of the following shows high first pass metabolism? Option A propanolol, option B phenobarbital, option C phenylbutazone, option D phenytoin. The correct answer is option A, propranolol. Okay. Next, pharmacovigilance is used for option A to monitor drug toxicity, option B to monitor unauthorized drug manufacture, option C monitoring of students, option D check costs. The correct answer is option A, to monitor drug toxicity. Next, Stevens-Johnson syndrome is the most common adverse effect associated with one of the following category of drugs. Option A sulfonamides, option B penicillins, option C macrolides, option D tetracyclines. The correct answer is option A, sulfonamides. Stevens-Johnson syndrome is the most common adverse effect of sulfonamides. Artemisinin contains the following group in its structure. Option A an endoperoxide, option B an exoperoxide, option C an epoxide, option D an acid hydrazide. The correct answer is option A, an endoperoxide. Next, streptomycin cannot be given orally for treatment of tuberculosis because option A it gets degraded in the GIT, option B it causes severe diarrhea, option C it causes metallic taste in the mouth, option D it is not absorbed from the GIT. The correct answer is option D, it is not absorbed from the GIT. Next, the given antibiotic is an example of ansamycins. Option A roxithromycin, option B adriamycin, option C aureomycin, option D rifamycin. The correct answer is option D, rifamycin. Nicotinic acid of acetylcholine is blocked by the drug. Nicotinic acid of acetylcholine is blocked by the drug. Option A atropine, option B carvedilol, option C neostigmine, option D D-tubocurarine. The correct answer is option D, D-tubocurarine. Selective serotonin reuptake inhibitor is option A imipramine, option B iproniazide, option C fluoxetine, option D nefazolin. The correct answer is option C, fluoxetine. Improvement of memory in Alzheimer's disease is brought about by drugs which increase transmission in option A cholinergic receptor, option B dopaminergic receptor, option C GABA receptor, option D adrenergic receptor. The correct answer is option A cholinergic receptor. Which one of the following is a plasminogen activator? Option A tranexamic acid, option B streptokinase, option C amino caproic acid, option D none of the other option but none of the above. The correct answer is option B streptokinase. Next, which one of the following drugs does not act through G protein coupled receptors? Option A epinephrine, option B insulin, option C dopamine, option D TSH. The correct answer is option B insulin. Which one of the following drugs is not a typical antipsychotic agent? Option A chlorpromazine, option B haloperidol, option C risperidone, option D flupentixol. The correct answer is option C risperidol. Identify the drug which is not used in the treatment of malaria caused by Plasmodium falciparum. Option A artemisinin, option B primaquine, option C quinine, option D mefloquine. The correct answer is option B primaquine. Metabolite of spironolactone is option A aldosterone, option B candinon, option C corticosterone, option D pregnenolone. The correct answer is option B candinon. Next, the starting material for the synthesis of alprazolam is option A 3-amino 5 bromoacetophenone, option B 2-amino 5 chlorobenzophenone, option C 2-amino 5 bromoacetophenone, option D 3-amino 5 chlorobenzophenone. The correct answer is option B 2-amino 5 chlorobenzophenone. A new drug delivery system which is composed of phospholipids that spontaneously form a multilamellar concentric bilayer vesicles with layers of aqueous media separating the lipid layers is the correct answer is option B liposomes.